Welcome to day 299 at the EMA office where we're bringing you the latest information on the COVID numbers, joined with Chairman Kern and Sam Behrman from the Health Department. Sam, and you do have our numbers today.
I do. We are down a little bit in our percentage rate, which is great, but we're higher in some other numbers than we would like to see. So as of today, 215,607 St. Clair County residents have been tested, which is an increase of 1,135 from yesterday. We are at 22,069 positive test results, which is an increase of 143 from yesterday. And that does include both males and females from under the age of 1 up to their 80s. Today, our daily county positivity rate is 12.6%, so we are down a little from yesterday. And we are at 193,538 negative test results. Unfortunately, we are announcing 7 new additional deaths today, which does bring our total for St. Clair County to 347. We had a male in his 50s, a female in her 60s, a male in his 70s, a female in her 80s, and 3 males in their 90s, all with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 19,857. For state totals, 13,698,428 have been tested, with 999,288 positive test results, which is an increase of 7,569 from yesterday. And for deaths, the state is reporting 17,096, which is an increase of 139 from yesterday. For St. Clair County hospitalization numbers, currently we have 120 patients that are admitted due to COVID-related reasons, and 9 of them are on ventilators. Regionally, we have 200 patients that are admitted due to COVID-related reasons, and 14 of them are on ventilators. For congregate living facilities that are currently or previously have been in outbreak status, please remember these are cumulative numbers, and we will only announce any facilities that have had changes. Cambridge House in Swansea has 17 cases and no deaths, and that is an increase of 3 cases for that facility. Caseyville Nursing and Rehab has 160 cases and 10 deaths. That is an increase of 1 case for that facility. Colonnade in O'Fallon has 17 cases and no deaths. That is an increase of 1 case for that facility. Four Fountains in Belleville has 131 cases and 29 deaths, and that is an increase of 2 cases. Integrity Healthcare of Belleville has 84 cases and 2 deaths, and that is an increase of 3 cases. Mercy Rehab and Care Center in Swansea has 123 cases and 12 deaths, and that is an increase of 1 death for that facility. Morningside of Shiloh has 19 cases and 2 deaths. That's an increase of 1 case and 1 death for that facility. And Sycamore Village in Swansea has 24 cases and 1 death, and that is an increase of 1 case for that facility. So as you guys can see, we had 8 facilities that had changes, several with deaths. So, as we had said in the beginning, while we're doing everything right, those are some of our most fragile members of the population, even more so now that we are moving forward to, getting closer to getting the vaccine out to them, doing everything that we have been doing up until this point, wearing our mask, watching our distance, washing our hands. The staff does the best they can with the residents that they have, and, we've got to keep going.
So Barb, how is the vaccine getting to the congregate living facilities? That's really the state. Mm-hmm. That's not. It isn't like we're delivered vaccine and then we get it to Walgreens to give.
That is correct. So there is a partnership program that the state IDPH came up with. It's a CVS Walgreens partnership program. And we submitted all of our long-term care facilities to the state. They entered them in the program. And what that does is then the state works with those big chain pharmacies. They come into our long-term care facilities on, I believe they set 3 separate dates. So they're, hitting all of their residents and their staff to make sure that they all get both vaccines. But it's taking that load off of the locals. So they are coming in and doing some of our long-term cares, and we have heard that a couple of them so far have already received vaccinations.
But that's really the Illinois Department of Public Health that is handling the
That is
congregate
correct.
living facilities.
Yes.
Okay, because they're the ones that have the vaccine.
Correct. Yes.
Okay, so we'll move into the zip code report for today. 62204 is our first zip code, up 1 to 329. 62205, up 4 to 528. 62206, up 2 to 1,041. 62208, up 9 to 1,265. 62220, up 22 to 1,526. 62221, up 13 to 2,101. 62223, up 8 to 1,327. 62225, up 2 to 108. 62226, up 25 to 2,399. 62232, up 4 to 705. 62239, up 5 to 345. 62240, up 4 to 1,000 or to 114. 62240, up 4 to 114. 62243, up 3 to 557. 62254, up 3 to 631. 62257, up 2 to 250. 62260, up 8 to 552. 62264, up 3 to 258. 62269, up 20 to 2,441. And 62285, up 2 to 421. 143 new positives today, with 1,135 people tested, brings our county positivity down today to 12.6%, which also brings our rolling average down 0.1 to 14.5%. The state has our regional positivity pegged up to 13.3%, derived by Bond County at 17.9%, Clinton County 16.5%, Madison County 18.5% positivity, Monroe County 7.1%, Randolph 6.0%, St. Clair County at 13.5%, and Washington pegs in today at 23%. All too high. Hospitalizations, 120. I mean, those three-digit hospitalizations are very worrisome. The number of people on ventilators is down a little bit to 9, I think. But the numbers are just, they're out there, and we've got to remain vigilant until all the vaccine comes in and we're able to get it in people's arms. We've got a long way to go, folks.
7 more deaths over the last 24 hours, up to 347 here in our county, and we keep preaching at it every day, have been for 299, and there are still several people out there who don't think it's anything to worry about, but you know, in the region, hospitals overnight went up 7. We're up to that 200 again, and as you said, in the county, it went up 3. The ventilators down 2, but could because of 7 deaths. So as you said, we've got to stay vigilant. You know, 64 of those who tested under the age of 40. One of those deaths, a male in his 50s. So the old saying of some people were saying, well, it's only in the elderly. I don't think 50 is elderly. And so we've got to take that very, very serious. I know you're tired of hearing us say that, but unfortunately, you're going to continue to hear us saying that until we can get the vaccine into everybody. The health department's doing the best they can, working daily. You know, you keep hearing us say it every day. We want to get it in the arms of all of us, and we got to get this thing behind us, but we can do it together. Team St. Clair, please keep sharing this, sharing the word. I know some of you left messages last night. You called today. You're wore out. You don't think there's an end in sight, but there is. Please don't give up of hope, because we're here with you, and we're going to continue to bring these briefings to you. Hopefully, in the next couple of days, you know, we're getting past the New Year's. These numbers hopefully will start leveling off, is what I keep hoping for and praying for every night. So I need your help to do that. So we'll be back tomorrow with day 300. We'll be back momentarily with Cindy and Daisy to translate this into our Spanish communities. Everybody have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this daily virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.